The system is unaffordable, inefficient, and not patient-centric. You can't have 40 million hours of ER wait time and claim to be a patient-centered system. It's just not plausible. It's really a legacy system that's been through one reinvention since the 60s. Right now, the health delivery system is highly concentrated around institutions. Take a look at the distribution of dollars in provincial budgets, and it still flows to institutions. The number of beds in Canada since 1960 has actually gone down by 8%, but the amount of money going into the institutional sector hasn't. So they're holding on to ground that really shouldn't be there. The new system would have many more specialty clinics, specialty service areas, distributed across communities. If you take a look at the private sector in Canada, where they deliver health services that are adjacent, so physiotherapy. There are 3 or 4 big providers in each province that deliver physiotherapy, and they're highly specialized and they focus on the customer. Would you prefer to have an urgent care center in your neighborhood where you can park for free and get to see a physician in 20 minutes, or would you rather drive to a hospital, pay $35 to park, and wait for 8 hours? The hospitals in particular operate as though they're going to do everything for everybody, and they do, and it's expensive and it's inefficient. We need considerably fewer hospitals, but when you close a hospital, people get very, very angry. But you ask those same people, do you want to be in a hospital bed? And of course they don't. There's an inherent contradiction between what they say they want, which is a patient-centered system, and recognizing that patient-centered means closing hospitals. The biggest barrier to change in the health system isn't the public. It's the health system itself. The system continues to be overfunded, and that's problematic for people to hear, but there is too much money in the system, and so our changes are all sort of frictional, gradual changes at the edges rather than transformational change. The conversation about a profoundly different system is really just beginning. There's a lack of clarity around who's going to lead the change, and and what the change is. It unfortunately has to come from the government, and I don't believe because of how it's structured that they're capable of doing it. It's unlikely that it'll come from the vested interests within the industry. What I suggest we need to do is pull back and imagine a system designed by lean principles that is predicated on not what we have now, but what's possible now. And that's where the transformation comes. What's possible now is a radically disaggregated or distributed system informed by digital patient records and standardization of care. For the price of building another mega hospital, which at least in Ontario they seem to really like building them, we could get a fully integrated electronic patient record that crossed both community and institutional sector, but also included the private sector. Once you have a digital backbone for how health services are delivered, the location that delivery occurs at disappears as an issue. You need the practitioner and you need the information. And once it's widely available, the sort of institutional defense collapses. There are health management organizations in the US that are doing it very well. Northern Ireland, which is interesting because they did it all of a sudden very recently. They've got an excellent system that's not institutionally focused, has enough institutional services to meet the population's need, but they reimagined their entire system and have something much closer to what's possible here. Canada's healthcare system today is a good system. It performs internationally in the middle of the pack. It provides excellent care, but it's pretty tired, and our performance reflects that we're basically out of date.